Welcome to the Mentor mini-series on teaching scripts and chalk talks, Episode 5, Strategies for Promoting Learner Engagement and Retention. Have you ever been teaching a group of learners and successfully grabbed their attention, only to lose it midway through your talk? Well, just because you hook their attention at the start doesn't mean that you get to keep it without some continued effort. Because our learners' environment is full of distractions, we need to continuously refocus them. And because they have so much constantly in their minds, we need to teach information in a way that is sticky. Fortunately, human brains are wired in such a way that the same types of inputs that promote engagement also promote memory. Therefore, strategies for learner engagement and recall include stories, hypotheticals, and cases, leveraging the power of the imagination, questions, stimulating curiosity, mental frameworks, providing a sense of simplicity and novelty, and visuals. The science behind these strategies are covered in our mini-series, Presentation Best Practices. In this video, we'll explain how to practically use them to improve our chalk talks and teaching scripts. Stories, hypotheticals, and cases are valuable tools that are briefly covered in our video on the hook, and are covered in more detail in the Presentation Best Practices mini-series. The use of questions is also discussed in our video on the hook, and is covered extensively in the Clinical Teaching mini-series, but it's still worth covering some of the high points here. Questions can be used throughout our talks to promote engagement and memory. They can be used to transition between teaching points, to assess a learner's understanding, or as a means of applying what you just taught. To keep an entire team engaged with various levels of learners, you should pre-plan questions for each level of learner so that all learners feel involved. Asking why and how questions can be highly effective at piquing curiosity and promoting engagement. And if you're looking for a fast response to keep forward momentum, then ask questions that cannot be wrong. Like, how have you seen someone approach dyspnea before? Sequences of Socratic questioning can also be employed throughout the teaching, as can be seen in this example chalk talk on ascites pathophysiology and hepatorenal syndrome linked here. Now, let's talk about mental frameworks and how they promote a sense of novelty in our learners. Leveraging novelty in teaching does not simply mean teaching new content. It means relaying complex information in ways that are refreshingly clear. Mental frameworks are a group of tools that help us simplify and organize complex information in meaningful ways, often by elucidating hierarchies, patterns, and relationships within the content. We'll review two types of mental frameworks: advanced organizers, which are visual frameworks, and mnemonics, which do not rely on visuals. The term advanced organizer carries a few different definitions in education and is sometimes used interchangeably with graphic organizer. For our purposes, we will use the term advanced organizer to mean a visual schematic that enhances understanding and relatability of complex topics. Three types of advanced organizers are charts, flow diagrams and algorithms, and visual analogies. Charts are best used to show disease entities across a spectrum, or to delineate differences within similar topics, like this chart showing the similarities and differences in high risk, intermediate risk, and low risk pulmonary embolism. Flow diagrams and algorithms can be used to display processes, or can even be used as an action-oriented way to relay the same information used in charts. For example, we can communicate the same information from our chart on pulmonary embolism using a flow diagram. And although it contains the same information, it feels a lot different to the learner. Here, instead of explicitly showing how high risk and intermediate risk PEs differ from each other, this flow diagram focuses more on a stepwise rapid evaluation of PE severity. Flow diagrams can also be used to teach physiology, like the talk linked here. The third type of advanced organizer, visual analogies, can be highly effective and are only limited by your imagination. These excel at visual communications of hierarchies and relationships. Two examples are the dyspnea pyramid and the pain ladder. The dyspnea pyramid looks as follows and is meant to give a visual representation of the relative commonality of different causes of dyspnea. Respiratory causes are the most common, followed by cardiac, hematologic, acid-base, and psychiatric. Each layer of this pyramid could then be further expanded with specific etiologies. A learner will walk away from this talk with a clear memory of the relative commonality of causes of dyspnea. The pain ladder, or pain staircase, is a stepwise diagram that simplifies the approach to pharmacologic nociceptive pain management. It visually displays that all patients should be started with Tylenol and NSAIDs before progressing to opioids. And it also provides a stepwise escalation within the opioid section. Additionally, you could add clever visual cues to bolster your teaching, like drawing a stick man standing on the bottom 2 steps as you explain. Tylenol and NSAIDs are often started together as they are synergistic. The instructor can then add more details like indications and contraindications as they fill in and go up the pain ladder. The next type of mental framework, mnemonics, are variably effective and, like with all tools, are somewhat learner dependent. But, in essence, mnemonics are memory devices intended to help learners recall and organize large chunks of information through acronyms, memorable phrases, or clever letter idiosyncrasies. Perhaps the most well-known acronym mnemonic is AEIOU, the indications for dialysis. A well-known memorable phrase mnemonic is hot as a hare, dry as a bone, and mad as a hatter for anticholinergics. And here's an example of a mnemonic using clever letter idiosyncrasies to remember coronary artery anatomy. The LAD, is where the diags come off. And you can remember the obtuse marginals come off the left circumflex because the O looks like a circle. To use mnemonics in your teaching, feel free to borrow them from board review resources or create your own. But please recognize that mnemonics are a teaching tool that are not effective for everyone and can easily be overdone. By providing simplified schemas for complex topics that are easily understood and relatable, advanced organizers and mnemonics give your teachings a sense of novelty that both engages and enhances recall. In addition to mental frameworks, incorporating visual aids can be very helpful. Simplified anatomic drawings, like used in the Hypotheticals teaching script, provide learners a visual means to organize and link their knowledge. Simply referencing this illustration and drawing red arrows when you ask, is it coming from above? Is it coming from below? Or is it coming from the airway itself? Provides a visual reference for why the differential is built around oropharyngeal, alveolar, and airway diseases. When possible, you may even be able to combine advanced organizers and visual aids like this in the COVID-19 primer linked here. Importantly, visual aids do not always have to be drawn. Simply displaying real EKGs or radiographic images on a handout, on a team room computer, or on your phone can be an effective means of promoting the engagement and memory of your teachings. In summary, teaching in the clinical environment is challenging because our learners are constantly pulled in different directions. Fortunately, the same cognitive inputs that promote engagement also promote memory and can be leveraged by the following strategies. Tell stories. Ask purposeful questions to different levels of learners. Use mental frameworks like advanced organizers and mnemonics. And incorporate visual aids like simple anatomic drawings, EKGs, or radiographic images. Happy teaching!